Ever wondered why mental health matters just as much as physical health, if not more? Just like your physical health, your mental health plays a significant role in your overall well-being. It's the engine that drives every aspect of your life, from how you think and feel to how you cope with stress and relate to others. In our fast-paced world, we often neglect our mental health, focusing all our attention on physical fitness and dietary habits. But it's crucial to remember that our mental well-being is just as important. Understanding and addressing mental health conditions can lead to improved quality of life, better relationships, and even increased lifespan. We're about to embark on a journey, exploring the top 10 mental health conditions affecting people all across the globe. We'll delve into their symptoms, discuss their treatment options, and explore ways to prevent them. It's a journey of understanding, empathy, and enlightenment. So, are you ready? Let's dive in to uncover the top 10 mental health conditions affecting people worldwide. Starting our countdown at number 10, we have post-traumatic stress disorder, commonly known as PTSD. This mental health condition can develop after experiencing or witnessing a life-threatening event, such as a natural disaster, serious accident, terrorist act, war combat, rape, or other violent personal assault. Symptoms often include flashbacks, nightmares, severe anxiety, and uncontrollable thoughts about the event. Treatment for PTSD typically involves a combination of psychotherapy and medication. Cognitive behavioral therapy, or CBT, is often the most effective form of therapy, as it helps individuals learn how to control their fear and anxiety and change the thought patterns that lead to them. Prevention may not always be possible. However, seeking help immediately after a traumatic event or as soon as symptoms appear can help reduce the severity or prevent PTSD from becoming a long-term condition. With the right support and treatment, individuals with PTSD can lead fulfilling lives. Next on our list at number 9 is Obsessive Compulsive Disorder, or OCD. This mental health condition is characterized by recurring unwanted thoughts, ideas, or sensations, known as obsessions, that drive individuals to do something repetitively. These are the compulsions. Common compulsions may include excessive cleaning, repeated checking, or adhering to strict routines. It's important to note that these actions go beyond healthy habits or rituals. They are excessive, time-consuming, and often not connected in a logical way to what they're meant to address. Treatment for OCD typically involves a combination of medication and psychotherapy. Cognitive behavioral therapy, specifically a type called exposure and response prevention, is considered effective in reducing compulsive behaviors. Prevention is not always possible, as OCD is thought to have a genetic component. However, early diagnosis and treatment can help manage symptoms and prevent the condition from interfering with daily life. OCD can be challenging, but it's not insurmountable. Help is available. Moving on to number 8, panic disorder. This particular mental health condition is characterized by recurring, unexpected panic attacks. These attacks are sudden periods of intense fear that come on quickly and reach their peak within minutes. Symptoms can include a pounding heart, sweating, trembling, feelings of impending doom, or loss of control. Now, let's talk treatment. Cognitive behavioral therapy is a mainstay in managing panic disorder. It helps you understand what triggers your attacks and how to respond to them. Medications like selective serotonin reuptake inhibitors and benzodiazepines can also be beneficial. Prevention, though not always possible, can be aided by regular exercise, adequate sleep, and a balanced diet. Avoiding caffeine, alcohol, smoking, and recreational drugs, which can trigger panic attacks, is also advised. Remember, panic disorder is treatable, and you are not alone. Reach out to mental health professionals who can guide you towards a healthier, calmer life. At number 7, we have eating disorders. These complex conditions encompass a range of abnormal or disturbed eating habits, often stemming from an individual's obsession with food, body weight, or body shape. The most common types include anorexia nervosa, bulimia nervosa, and binge eating disorder. Symptoms can vary widely, but they often involve extreme emotions, attitudes, and behaviors surrounding weight and food. These could manifest as severe restriction of food intake, frequent episodes of eating unusually large amounts of food, or feelings of distress or guilt after eating. Treatment for eating disorders typically involves a combination of medical, nutritional, and therapeutic approaches. It's crucial to acknowledge that these are serious, life-threatening conditions that require professional help. To prevent eating disorders, fostering a positive body image, promoting healthy eating habits, and discouraging dieting can all play a vital role. Remember, recovery from eating disorders is possible. Reach out for help. Halfway through our list at number 6 is bipolar disorder. This mental health condition is characterized by extreme mood swings that include emotional highs, known as mania or hypomania, and lows, or depression. These episodes can last for several days, or even weeks, and can cause unpredictable changes in mood and behavior, resulting in significant distress and difficulty in life. Treatment for bipolar disorder usually involves a combination of medication and psychotherapy. Mood stabilizers, antipsychotics, and sometimes antidepressants are commonly prescribed. Psychotherapy or talk therapy can provide strategies to manage symptoms and cope with life challenges. Prevention is a bit more complex. While it's not possible to prevent bipolar disorder outright, getting treatment at the first sign of mental health symptoms can help prevent bipolar disorder or other mental health conditions from worsening. Regular follow-ups and maintaining a stable and structured lifestyle can also help manage the symptoms. With proper treatment and support, individuals with bipolar disorder can live a healthy and productive life. Coming in at number 5 is depression. A common but serious mood disorder, depression affects how you feel, think, and handle daily activities. Symptoms may include persistent sadness, loss of interest in activities once enjoyed, difficulty sleeping or sleeping too much, and feeling worthless or guilty. Depression can affect anyone, regardless of age, gender, or background. It's important to remember that it's not a sign of weakness or a character flaw, but a real medical condition with real treatment options. Treatment often involves a combination of medication, psychotherapy, and lifestyle changes. Antidepressants can help manage symptoms, while cognitive behavioral therapy can teach you how to challenge negative thought patterns. Regular exercise, a healthy diet, and adequate sleep can also play a crucial role in managing depression. Prevention can be challenging due to the complex nature of depression, but maintaining a healthy lifestyle and seeking help when needed can make a significant difference. Remember, depression is treatable. Don't hesitate to seek help. At number 4, we have anxiety disorders. These are a group of mental health conditions that trigger excessive nervousness, fear, apprehension, and worry. These disorders alter how a person processes emotions and behaves, also causing physical symptoms. Common types include generalized anxiety disorder, panic disorder, and various phobia-related disorders. Symptoms vary, but they generally revolve around excessive, irrational fear and dread. These might interfere with daily activities and could be difficult to control. For treatment, a combination of psychotherapy, behavioral therapy, and medication is often effective. Cognitive behavioral therapy, a type of psychotherapy, is especially useful in treating anxiety disorders. Prevention can be tricky as the exact cause of anxiety disorders isn't known. However, maintaining a healthy lifestyle, reducing caffeine and alcohol, quitting smoking, and employing stress management techniques can be beneficial. Remember, everyone feels anxious now and then. It's a normal part of life. But when persistent anxiety interferes with your life, it's time to take action. Anxiety is a part of life, but it doesn't have to control your life. Moving on to number 3, schizophrenia. This mental health condition is characterized by a range of cognitive, behavioral, and emotional dysfunctions. Symptoms can be broadly categorized into 3 areas: positive, negative, and cognitive. Positive symptoms include hallucinations and delusions, while negative symptoms may involve a lack of motivation or emotional withdrawal. Cognitive symptoms often involve difficulties with concentration or memory. Treatment for schizophrenia typically involves a combination of medication, psychotherapy, and social support. Antipsychotic medications are usually the first line of treatment, often combined with psychological therapies such as cognitive behavioral therapy or family-focused therapy. Preventing schizophrenia can be challenging, as the exact causes are still not fully understood. However, early intervention at the first signs of symptoms can significantly improve long-term outcomes. This includes seeking help when experiencing troubling thoughts, feelings, or behaviors, and maintaining a healthy lifestyle, including regular exercise and a balanced diet. Schizophrenia can be managed with the right treatment and support. At number 2, we have autism spectrum disorder, or ASD. This condition is characterized by a range of symptoms such as difficulties in social interaction, communication challenges, and repetitive behaviors. It's a spectrum disorder because it affects individuals differently and to varying degrees. Early diagnosis of ASD is crucial as it can significantly improve the quality of life for those on the spectrum. Treatment typically involves behavior therapy, speech and occupational therapy, and in some cases, medication. Each treatment plan is tailored to meet the individual's unique needs. Research into potential prevention strategies is ongoing, but currently, there's no definitive method for preventing autism spectrum disorder. However, early intervention can significantly improve a child's development. Educating oneself about ASD is a step towards understanding and accepting those who live with it. Remember, every person with ASD is unique and can lead a fulfilling life with the right support. And finally, at number 1, we have attention deficit hyperactivity disorder, commonly known as ADHD. This condition is characterized by persistent patterns of inattention, impulsivity, and hyperactivity that can significantly impact daily life. Symptoms can vary widely, but often include difficulty focusing, forgetfulness, restlessness, and impulsive behavior. It's important to note that ADHD is not just a childhood disorder. Adults can have it too, and it can manifest differently at different stages of life. Treatment strategies for ADHD often involve a combination of medication, behavioral therapy, and lifestyle changes. Stimulant medications are sometimes used to help manage symptoms, while cognitive behavioral therapy can teach individuals to cope with challenges and manage their behavior. Regular physical activity, a healthy diet, and adequate sleep can also play crucial roles in managing ADHD. Prevention is less straightforward as the exact causes of ADHD are not fully understood. However, a healthy pregnancy, early intervention, and consistent behavior management strategies can help mitigate risks. ADHD can be challenging, but with the right help, individuals can thrive. And there we have it, our top 10 mental health conditions. The journey through this list has been enlightening, even if the topics were quite heavy. From post-traumatic stress disorder to attention deficit hyperactivity disorder, it's clear that mental health conditions are diverse and widespread. They can affect anyone at any time, regardless of age, gender, or background. The crucial takeaways? Firstly, these conditions are not rare or unusual. Countless people around the world manage these challenges every day. Secondly, help is available. Therapy, medication, lifestyle changes, these are just a few of the many treatment options out there. Lastly, and perhaps most importantly, there's no shame in having a mental health condition, and there's no shame in seeking help. We must strive to break the stigma and foster understanding and compassion for those affected. Remember, mental health is just as important as physical health. Don't neglect it.